Good evening, everyone. My name is Lindsay Zapletal, and I am the Assistant Director of Alumni Relations in the College of Health and Human Development. I am pleased to welcome our alumni and friends to our first HHD On Location Home Edition, bringing HHD to you in your home. In tonight's program, Impacts of COVID-19 on Penn State undergraduate students, we will hear from Stephanie Lanza and Courtney Whetzel of the Edna Bennett Pierce Prevention Research Center. Dr. Stephanie Lanza is a professor of biobehavioral health and has served as the director of HHD's Edna Bennett Pierce Prevention Research Center since 2017. And she's also the director of Penn State's Consortium to Combat Substance Abuse since 2018. Stephanie joined Penn State in 2004 and has devoted her career to advancing research on the prevention of substance abuse and addiction through the use of innovative quantitative methods. Stephanie is the lead scientist on the Penn State CORE study, which will be discussed this evening. Dr. Courtney Whetzel is a project manager in the Prevention Research Center, and she brings over 20 years of research experience ranging from benchtop science to daily diary fieldwork. She holds a PhD in biobehavioral health from Penn State. Her main projects include Penn State Self, Student Engagement, Learning, and Flourishing, Penn State CORE, College Relationships and Experiences, and the most recent second data collection of the CORE study. Stephanie and Courtney will present tonight for about 40 minutes, leaving time for questions at the end. If you have a question, please type it into the Q&A chat function found in the menu bar of your Zoom application. So I am pleased to turn tonight's presentation over to Stephanie and Courtney. Thank you.
Hi, everyone. Thank you so much, Lindsay. It's really a pleasure to be with everyone tonight and to be able to talk a little bit about very early results of indicators of how we're seeing the COVID-19 pandemic affecting our Penn State youth. I'm Stephanie Lanza, as Lindsay said, and I've been the director of the Edna Bennett Pierce Prevention Research Center for 3 years now. And yeah, 3 years, I had to count. And a year ago, I was really fortunate to have Courtney join us. Courtney, do you want to say hi? And so tonight we're excited. We're going to be able to present some results that we'll walk through with you that literally were compiled today. This is very, very recent, kind of hot off the press results from a study that we just concluded. And so much to come with disseminating our findings. You are going to be the very first to see them. And I actually myself only saw these about 30 minutes ago. So we're just gonna go for it. Anything else, Courtney, before I share my screen?
I don't think so.
Okay, great. Yeah. So we put together a PowerPoint presentation for you. I think there are just over 20 slides. So we have plenty of time to go through them. And they're a little data heavy, but I think that what we wanted to know and what we wanted to share with you tonight is what we're learning about our Penn State students. And so let's see, I'm going to share my screen so that you all can see. And okay, great. Great, so this is a talk about a study called Penn State CORE, which stands for College Relationships and Experiences. Little did we know when we were planning this study back last year in 2019, what kinds of experiences our students were going to be facing. And we're really happy to be in this conversation with you tonight. I just thought it's always good, for me at least, I'm an HHD alum myself. I got my PhD in Human Development and Family Studies, as is Courtney, ironically, who got her PhD in biobehavioral health. And it's, I think, good just to kind of see where we're talking from tonight and in the Prevention Research Center. And so the College of Health and Human Development, led by Dean Newshafer, comprises 8 academic departments. And so you'll see human development there, biobehavioral health there, probably some programs that some of you are more familiar with there. And in addition to housing 8 academic units in our college, we also have several research centers, and these are that cut across disciplines. And so the research centers that, the college supports include the Center for Childhood Obesity Research, the Center for Healthcare and Policy Research, the Center for Healthy Aging, and our center, the Edna Bennett Pierce Prevention Research Center. And so you'll see that the research centers are thematically organized. And so our goal is to really focus on prevention science. So the Prevention Research Center is quite large, and we are a national and even an international leader in research, training, and outreach related to prevention science. And I'll define that in a minute. So just broadly defined, the goals of everybody that affiliates with our center are really to promote healthy lifestyles and good decisions and resilience for children, youth, and families, which will boil down to healthier communities. And so our research really examines collectively how communities can work together with families, with schools, community groups to support positive outcomes for children, youth, and families. Prevention is a funny thing. Like we're used to thinking in our society in America, we're used to thinking about treatment. So somebody develops a problem, we treat it. They contract a disease and we treat it. And our goal is to really think more on the prevention side of this. And we focus not so much on chronic diseases, although we focus a lot on addiction, but we're not a medical center. We focus more on prevention of problems that I would argue are even more complex and difficult to measure and prevent. So rather than focusing on the treatment of diseases such as diabetes and addiction, or on the consequences of something like academic failure or criminal activity, we are conducting and leveraging research to create programs or policies that are designed to prevent these and other devastating outcomes before they even occur. And so that's just to kind of get you into our mindset when we are thinking about promoting well-being at Penn State and in our nation. We're really trying to identify problems and solve them before they actually occur. So it's a kind of a tricky game to play, but that's our mission. In addition to the Prevention Research Center, which is housed in our college, the university has established this larger entity called the Consortium to Combat Substance Abuse. And this was formed 2 years ago. The Provost Nicholas Jones, announced this initiative as a major new Penn State initiative in alignment with our strategic plan, and specifically the enhancing health part of our plan. This came about, of course, because the opioid epidemic has captured our attention as public and as funders, as researchers, and as citizens. But it's much more than that. And the reality is young adults are particularly high risk for a lot of types of substance misuse and related harms. And we're going to be successful in promoting health and well-being in our youth and our college students unless we're paying attention to the harms that are related to alcohol-related incidents. Daily marijuana use rates are at an all-time high, and vaping is skyrocketing, and it's quite prevalent on our campuses, as you'll see in a minute. And so I've been fortunate to be able to be the first director of this consortium to get it off the ground. And so this is another lens that I bring to this conversation tonight. And this is the impetus for Penn State CORE. I was interested, what really started to happen is as the opioid epidemic became part of our consciousness at Penn State, there was a natural tendency to think, well, there's an opioid epidemic nationally, and the university is going to invest in this initiative, the CCSA. We must have an opioid problem here on campus. And we did not believe that was true, but we decided that, rather than coming out and just saying we don't think it's true, we thought we should be definitive on this. And so this consortium to combat substance abuse was the origins for the Penn State CORE study that we're going to talk about. So what is this study, which Courtney named it? I love that name, Courtney, thank you. we refer to it as a light touch survey of Penn State undergrads. So we wanted to reach many, many Penn State students, current students, and we reached across 9 campuses, University Park, plus 8 Commonwealth campuses. And we wanted to do a brief survey and try to learn a lot in a few minutes from all of those students so that we could get kind of the lay of the land. We wanted to just capture the landscape today. And at the time, again, we were thinking about substance use and misuse. And so we were able to get into the field and do this study in partnership with the Social Science Research Institute, the Huck Institute for the Life Sciences, and the Prevention Research Center, kind of jointly funding this, but again, with the provost's support as well. And we did this in partnership with the Student Affairs Office at Penn State, which is the office that develops and supports and runs a lot of student programs that our undergrads can benefit from. And an interesting piece of this study was that we also consented students who participated in this one, and this will it'll become clear why this was important and serendipitous. We consented them to be contacted for future research studies. So we had them as an audience, we learned about them, and then a subset of them, more than half, agreed to be contacted again. So this would become really handy because this was again in November 2019, just as the global pandemic was taking off and just before it really hit the shores of the United States. So we completed that study. It was, we were intense and quick, and we completed it, ran it in November, and then we started producing our reports and communicating out. Key assessments in this first wave of the CORE study, which was supposed to be the only wave, were lots of different health behaviors. Of course, substance use being our driving goal here to understand substance use, contemporary on campus. We also paid attention to mental health. We assessed pretty carefully their depression and anxiety symptoms. Also things like feelings of belonging at Penn State. And we also happened to assess a construct that I think is growing in its importance, and our awareness of it is food insecurity in college campuses. And so we assessed from these students specifically about their food insecurity. So these are really our primary goals at the time. And I'm going to share a few results from this study, not too many of them, because this again was before the pandemic. And so some of the things that we learned from the 4,351 students who responded, again, from across 9 campuses. About half of them were University Park students. And again, more than half agreed to be contacted again in the future for future studies. So this is just a little bit of information from our first report that shows the prevalence of different substance use behaviors among our students. And so I'll just take a moment and walk through this so you can see if it's meets your expectations or experiences when you were at Penn State, or if these are raising any red flags for you. But so in the past month, 33% of the male students and 33% of the female students reported a binge drinking episode. And that's defined as males having 5 or more drinks in a setting, and females having 4 or more drinks in a setting. And so that's a third of them in the past month have engaged in binge drinking. High intensity drinking is twice that threshold. So 10 drinks in a sitting for males and 8 for a female. And high intensity drinking is particularly risky. And you'll see that binge drinking is prevalent, but high intensity drinking is very risky, and it's also quite prevalent as well. 15% of males and 9% of females. We assessed vaping, past month vaping among our students, and 21% of them reported vaping in the past month, compared to only 6% who reported cigarette use. And that was pretty consistent with our expectations of national trends. Marijuana use is also quite common. 17% of all the students reported past month, any marijuana use in the past month. It's a little bit higher if you just look at University Park, but not that much higher. And it's probably not surprising to you all based on changing policies, but daily marijuana use among young adults nationally is at an all-time high. It's as high as it's ever been. So we're really trying to take a look at this more carefully and think about the fact that students often are mixing substances like alcohol and marijuana in the same episode, which is, again, really elevates the risk and the consequences. So we're paying a lot of attention to these substances. Really, it's drinking, vaping, marijuana. We see a very little bit of cigarette use. 5% who have reported ever using a prescription stimulant misuse. And so taking something like Ritalin without it being prescribed for that purpose for them. And the prescription painkiller misuse, which would be the most likely opioid that our students would have ever tried. Only 2% have ever experimented with a prescription painkiller misuse using not as prescribed. And so we didn't even bother to ask about other opioids like heroin. We knew the rates would be 0 or near 0. So this confirmed what we wanted to make sure we were able to say, that our students do not have an opioid problem, but we do have a lot of recreational substance use, which we'd like to continue to work on in our center, addressing some of that. So that was really, again, kind of what we set out to find. We also took a close look at their mental health. And just really briefly, we organized the data and categorized people into levels of anxiety risk and levels of depression risk. And so you'll see anxiety is moderate anxiety is 22%, elevated anxiety risk. I think that's the higher category. Yes, Courtney's saying yes. So really elevated anxiety, we have 22%. Those are using some national norms. And we also have 40.5% that have a higher risk of depression than we'd like to see. So these are symptoms, reports of symptoms. So again, we captured this information in November. And just a few other points of interest maybe for you. We had, of our sample of 4,300 students, we had 56% were females, 88% were heterosexual, straight. 74% are residents of Pennsylvania, they're permanent residents. So more than half are out of state or international students. Yeah, more than 25%, sorry. Only 8% were actively currently affiliated in the Greek system. Now we were favoring first and second year students. So I think the process of joining a Greek society is a little bit slow. So that's not to be overgeneralized, but we had some active participation. 45% work full or part-time. And you can see the rates of bachelor's or higher degrees for mothers, for fathers, and 51% of our participants in our study lived on campus in the college dorm or residence hall. And then I mentioned this food insecurity item. Very recently, President Barron at Penn State has tasked a group of people at Penn State to develop a new task force on food and housing insecurity. And we are really, it can be shocking to think about it, but we are talking about the food and housing insecurity of our undergraduate students primarily. It is a concern, it is a national concern. And so we asked about this, and based on the national measures that are used to measure food insecurity, our students have a 35% food insecurity rate. Now that's a pretty, it's a pretty strict definition. If they had any hint of food insecurity, they're in that 35%. But it is indeed quite a significant problem at college campuses everywhere. The percent food insecure really varied across racial, ethnic background. And if you think about this, this is really hard to kind of absorb, but 66% of our Black students that participated in this survey reported food insecurity. 53% of Hispanic students, 49 multiracial ethnic groups, 39% of Middle Eastern, 37% Asian, and 33% of our white students. And so you see some really big racial ethnic disparities here, which is something that I think Penn State is, by forming this task force at the president's request, is a problem that Penn State is taking on. And one other thing about food insecurity, we also asked about students' experiences of discrimination during the past month for any cause, and they might presume it to be based on their poverty level or their racial ethnic group or their sex. It could be anything, sexual minority status. But we do see that the students who reported more frequent discrimination have shockingly high rates of food insecurity. And so we definitely are seeing something here that seems to align discrimination with SES, the social economic status. So I really wanted to share those results with you so that you could see where we were coming from, what we learned in November. And again, this is, you know, unbeknownst to us, this coronavirus was creeping across the globe and soon to reach us here in Pennsylvania. And as a substance use researcher, it was very important to me to consider the fact that I would say that COVID-19, this pandemic really raises the stakes. It raises the stakes for many things, economic hardships, mental health, many things, but also substance use. It can really raise the stakes related to substance use risks and consequences. For example, COVID-19 really could hit individuals who use substances or have a substance use disorder particularly hard. The vaping deaths that have happened in the nation, and those were really primarily vaping THC, marijuana, not nicotine as much, but those who use cigarettes, smoke marijuana or vape, remember that COVID-19 attacks our lungs. And so those people, even our young adults, our students, are at elevated risk if they would protract the virus. Other issues for illicit drug users, which we don't have many of, thankfully. And COVID-19 also is, as our youth are going through Penn State and then setting off into their careers, COVID-19 is really going to compound the addiction crisis in America. We know that addiction problems they're called diseases of despair because they tend to be really co-joined with healthcare, economic, and social factors. And I think economic factors in particular, and mental health. So substance use is known historically to increase in recession times, and trauma experienced by today's youth may also lead to substance use disorders. So we are bracing for a future where we may see elevation in substance use disorders in our youth all over the country, and potentially Penn State students as well. And so we want to really keep our eye on this as we come out of this, this pandemic. So because of this, we were very motivated to continue to follow these students in the time of the pandemic. So I am going to turn it over here to Courtney, who can describe what we did as our next steps, in part because she did such amazing work, but also because I just got this 30 minutes ago. So I'm going to ask her to walk us through what we just found and what we're seeing. And please keep in mind, these are preliminary results, and they are 1,000 of the original students. So we can start to think about the pre and post-pandemic changes that we're observing. But remember, we were looking at the pre-results from 4,000 students, and the post-results, we have a smaller sample of just 1,000. So there's a lot of work to be done before we can make conclusive statements about the direct hit of the pandemic on some of these constructs. But we'll be working through those data rapidly. Courtney?
Sure. So we'll just be talking about some descriptives about what we measured and everything. But what was really great was we were able to ask some of the same questions, some of the same health behavior questions. We were able to ask the same depression, anxiety, feelings of belonging questions at Penn State. We were able to ask the same food insecurity questions. So how is their food insecurity doing now that they're at home or wherever they are, where they're living right now? But we also were able to add to this the housing insecurity questions, some nationally standard housing insecurity questions as well. We were able to add in a question about what are their barriers faced in remote learning. We were also able to put questions in about their coronavirus exposure, their testing history, and their perceived risk about contracting the virus. We were also able to see what their adherence to public health prevention behaviors were, such as hand washing, mask wearing, social distancing. And what was great was some of these measures are also measures that are going to be going into, well, actually are in a community-wide survey right now. And I think Stephanie's gonna maybe say a little bit more about that, possibly later.
Just a little bit.
A little bit more on this Data for Action that is a community-wide survey here around State College and the community in Center County. That's by a different group that's doing that right now, but we have some very similar measures in this COVID core follow-up that will be able to look at those measures with the students plus versus the community, which is really great. Next slide.
Oh,
sorry.
I'm driving.
Stephanie's driving, so. So what's great is here, out of these students that we pulled from, what we did here is these measures here we pulled exactly from the core as well. So these are mirroring exactly what we saw in the core for substance use. So with our binge drinking, the high intensity, the vaping, marijuana, prescription use, and the painkiller misuse, what you'll see here is all of the numbers except for vaping and cigarette use are all actually either lower or the same. The only numbers here that are higher are vaping and cigarettes used. So here, the vaping and cigarettes used 32% vaped over the last 30 days and 8% used cigarettes over the last 30 days. Now, what we don't know here, you can't make conclusive thoughts here because we don't know how many of these reported vaping or cigarettes or binging or marijuana use or anything from their previous ones. So we don't know how many users we actually are in this sample. So those are some results that we have to tease out later. We know that from this sample, this is what this sample is using in the past 30 days. We don't know what these guys did in the previous, back in November, but we're going to be looking into that and connect them to this to see if they changed, you know? Do we know that if people that binged before, are they going to be, did they binge now or what? We'll be able to connect those. So right now, these are just the descriptives just from this time point. So the only ones that we have changed here are vaping increased and cigarette use increased.
And marijuana really dropped quite a bit. I
Yes.
think. Yes.
Yeah,
A lot of them moved home. So.
Yes, a lot of them moved home, so their use changed.
Mm-hmm.
So when asked, are my chances of getting COVID-19 are high, the majority of our population said they disagreed with that statement. So around 40% said they disagreed. They didn't think that their chances were high of getting COVID. There is a percentage that said they were strongly disagreed. About 25% said they weren't sure. And then then it fell off. About 15% said they agreed. And there was even left about 4% said they strongly agreed that their chances of getting COVID were high. So there's a nice little curve there with the majority of them saying that they disagreed. They didn't think that their chance of getting COVID-19 were high. So we were also able to ask if anyone was tested for COVID-19. And we had 19 of our participants were tested, with 2 of them saying that they tested positive and had since recovered. And
Courtney, I'm sorry, can I interrupt? Yeah. Can you say when exactly the data were captured?
Sure. We captured these in this year. It was the very first week of May. So it was during their finals week. Yeah. So yeah, so during their finals week. So they were technically still active with Penn State during this time. So it was their first week, their finals week.
Thanks.
So this was, and then we were able to ask everyone, has anyone else experienced symptoms of COVID-19 since January 2020? And our participants reported 20% reported some level of symptoms, and we had mild, moderate, or severe. So we kind of lumped all of those together and said 20% reported some level of symptoms. And then we asked, have you been in close proximity to someone showing symptoms or who tested positive for COVID-19? And around 8% said yes, they had been in close proximity or around someone who tested positive for COVID-19. We asked them, how much of your lives been disrupted? by this pandemic. And around 53% said that their lives have been moderately disrupted. 42% said significantly disrupted, and 5% said there was no disruption in their lives. There's a very small minority that did not answer. On each of our questions, we said we had an option to say prefer not to answer. I didn't put those in the graphs on all of these because it's a very, very small percentage for that, but we did give them that option. So for their behavior questions, we asked about, and actually I can read this. I have actually the reports right here because they're hot off the press. So some of our questions, the behavior questions we were asking, like, have you ever been in close proximity to someone, wrong page. During the past 2 weeks, how consistently have you worn a scarf or facial mask when in public, when there's a chance of being within 6 feet of individuals who do not live with you, such as when grocery shopping? During the past 2 weeks, how consistently have you practiced hand washing according to current guidelines? Regularly wash hands with warm water and soap for 20 seconds. And then also, individuals vary in their ability and interest to practice social distancing. That is maintaining at least 6 feet between themselves and others, not including those they live with. Please indicate how often have you practiced social distancing during the past 2 weeks. And so here the graph is, the majority say that they were always practicing these behaviors. With the mask wearing, over 60%, they were always wearing masks when going out and about, if they had to be within 6 feet of somebody. Over 50% were always practicing hand washing, good hand washing behavior, with around 40% saying they were practicing their social distancing, which is interesting for this population. And then it goes down from there, around, so always, and down to, it's on a sliding scale from 6 to 5 to neutral, down to some. We even had some that said not at all for all 3 of those. So hopefully they were honest with what they were saying. So we did have some that were honest, to be honest about either some or not at all following those kind of guidelines. And so we were able to also ask about, well, what are some coping strategies? And these were questions that were taken from some NIH, just the National Institutes of Health, questions that other people are using in other standardized surveys as well. So possibly we'll be able to look at what other people around the country are reporting as well. So they were able to choose more than one, and these weren't responses that they could write in. So there wasn't like an other question so that they could write in like, what are some other strategies? These were kind of like set strategies that they could choose. And so a lot of people had some positive ones. It looks like there was a lot of positive things that they were doing, taking breaks from news stories, taking deep breaths, stretching, meditating, engaging in healthy behaviors, 66%, eating healthy meals, exercising regularly, getting plenty of sleep, making time to relax because they had time to do it. Making efforts to socially connect with friends, like 75%. I think that's really good. It's a really healthy coping strategy. 9% were contacting a counselor or mental health care provider. Then below this line, I kind of made a demarking line here about some negative health behaviors here. 4% said that they were smoking more cigarettes or vaping more. 18% said they were drinking alcohol. 8% said that they were using marijuana. 1% said they were using other drugs. And then we got to 40% were eating high fat or sugary foods. I know that there's more ice cream in my house during this pandemic. So I may say that that's more of a, comfort food kind of thing. So, but we know that they got through all of the drug questions and got down to the high fat and sugary foods ones. We know that they were getting down through the rest of the questions. So I feel good that the high fat and sugary foods was the last one there, went up. So we know that they were getting through those questions and it didn't just fall off and they were skipping that question. So I kind of feel good that that was the last question there. So
it's fun for all of us to think about what our coping strategies have been over the last month from this.
Yes, definitely. And so I think this is an interesting question too. This is also a question that's been widely used over different surveys as well. And it's a question that's going to be asked on the community survey. So we can see how the community around here in Center County would answer this question as well versus our sample of students. If a vaccine for COVID-19 were available today, what's the likelihood that you'd get vaccinated? And the majority, about 55% of our students said they would be extremely likely to get the vaccine. And then 20%, a little under 20% somewhat, there was, 12% said they were unsure. And then unlikely to very unlikely, it was a very small percentage. So the vast majority said that they would likely get a vaccine if it were available today. So I think that's a kind of an interesting stance on where they stood with their thoughts on vaccinations.
Mm-hmm. Okay, so we just wanted to kind of wrap up by telling you sort of what's next. What are we going to take on next? And so clearly, and we've alluded to this, that our first priority right now is to analyze the data that we just collected this month, focusing on these 1,004 students, and really trying to get a sense of changes that we've seen between pre and post the pandemic, the start of the pandemic. So we're going to take a close look at that. We also want to take a close focus on some other reports, building some reports to inform Penn State offices, and any offices that have an interest in these data. We plan to support them with some data and give them some empirical evidence of what we're seeing. We're in talks with the Student Affairs Office to talk about different programs that could be useful to support students. And we'll be sharing results from our questionnaire on how the remote learning has gone and what the students have found their primary barriers to remote learning have been. We're all hopeful, of course, that students will be returning to campus and stay there. But should there be a need at any point in the future for remote learning again, Penn State wants to be prepared for managing that in the best way we can. So we'll be taking a deep look at those data as well. We'll be taking a deep look at the impact of this pandemic on food insecurity as well. So two other kind of, those are, processing and our information and sharing our information. Those are numbers 1 and 2. Numbers 3 and 4 are the big studies that we're launching here that are considerably larger than what we just presented on. So the COVID-19 data for action, you'll start to see more and more coming out from Penn State on this. Matt Ferrari is one of the professors in biology. He's affiliated with the Center for Infectious Disease Dynamics here at Penn State. He's been doing disease modeling for the provost and the president. They've been very active. Penn State's taking an incredible research approach, data-driven approach to making decisions. I'm not privy to those decisions, but I have been really extremely impressed with how Penn State is approaching decision-making. So this data for action, Courtney alluded to this community study. There is, if you happen to live in Center County, take a look, data for action, you can search it, Penn State data for action, and you can take the community survey. It's very brief. And, but in that survey, you have the opportunity to get into a deeper study if you wish to volunteer. And then the Penn State CORE students that we just reported on, they're going to be invited into a subsequent student survey. And in both of these community and student surveys, these studies are going to be following these individuals for 1 or 2 years, hopefully 2. There will be repeated COVID-19 testing done 4 times per year is the plan. And so they're going to be surveying them for 2 years and monitoring disease incidence and spread among students and our community. And hopefully we'll have very little to see or detect, but should it be there, Penn State is going to be pretty well positioned to detect it and study it. So we're really happy that our projects have kind of been pulled into this larger umbrella of data for action at Penn State. We see everything that we do right now in the Prevention Center, in the college, at the university. So much of what we're doing is affected by COVID, and rather than ignore it or put everything on pause, our collective action has been, our approach has been, let's dig in and let's figure out how we can learn more, how we can help, and how we can inform good decision-making for everybody. So we're really happy to be part of that larger initiative now. And then finally, Penn State Self, which you heard brought up earlier, it stands for Student Engagement, Learning, and Flourishing. This is going to be a more in-depth version of Penn State CORE in the Prevention Center. This is the next kind of meaty study that Courtney and I are going to dig into. And so just in brief, the Student Engagement, Learning, and Flourishing study, it's funded by the provost at Penn State. It's under the Strategic Initiative grant-making program that we have at Penn State. So we're really grateful for our Penn State support to internally value this and let us focus on studying our students. So this is going to be an in-depth study of Penn State students in their daily lives as they go through their daily lives at Penn State. We're going to be monitoring daily student health and behavior in real context when they're out socializing, when they're in the dorms, wherever they are. The data are going to be collected and anonymous and shared to qualified Penn State researchers as a resource for research and future grants. And we're going to be investigating the biobehavioral underpinnings of health behaviors, including substance use. We'll be looking at their context and anxiety and more across 21 days. Each person across 21 days. And so we'll also be able to detect sleep and phone use information, again, in an anonymized way. But I think it'll be very informative for what the students are going through. And their social connectedness and mental health are important. And so this was the underpinnings for the original Penn State Self as we envisioned it and as it was funded. Then the pandemic hit. And so we are taking our ideas and similar to CORE, we're pivoting and kind of leaning into the situation we're all in. And we're going to continue to do our study, but we're going to pivot just a bit and really take into account, we'll be looking at 2,000 students in their daily lives. Each student followed for 3 weeks. But we're changing the design a little bit and the assessments also to be able to also study the effect of COVID-19 on our undergrads. So some of the changes that we're making are we're going to be adding into our daily battery of questions about behaviors. Obviously, our public health protective behaviors like mask wearing, hand washing, social distancing, if those maintain relevance over time, we'll continue to ask those questions. We're also going to have the 2,000 students phase in cohorts so that we will have daily diary data from undergrads at University Park that span the entire academic year. And so whatever comes with public health urgency or changes in regulations at the state level, whatever comes, if there's a reaction, an event publicly that happens and students might be reacting to, we're going to be able to map that onto our data and capture it because we'll have active student participants, we hope, through continuous time over the next academic year. I am going to unshare here, and those are the data that we wanted to share with you, and again, kind of focusing on really where we come from an HHD perspective, and where we feel that we could potentially be part of, hopefully, the answers and the solutions going forward. Okay, Lindsay, thank you.
Well, thank you, Stephanie and Courtney, both for sharing the information you all have found from your most recent study since the pandemic. We're going to take the next couple of minutes to ask our presenters questions that our audience had. So we'll start, Stephanie, with the last self-study that you shared. Will that study extend to the Commonwealth campuses?
That's a great question. The original design was that we were going to, again, reach out to the 9 campuses and distribute our data collection across them. Because of the intense uncertainty of what's happening, not just with return to campuses, but the heterogeneity between Abington campus and Greater Allegheny campus and a Barron campus and University Park campus, the fact that we're in different geographic regions and that this is complicated and we don't know what the future holds, we made the difficult decision to pull back and focus in on University Park, in part because the community survey is going to be also happening at the same time here at University Park. But to compensate for that, we are planning to continue to run Penn State CORE in the future and additional waves of that. And we were actually planning to go and include the 9 campuses so we can continue to track what's going on in Penn State undergrads across the campuses and possibly open it up to even more campuses. We'd love to involve all of the campuses. There's some cost to it that we have to figure out how to stand this up and
participation and how to get participation.
How to get participation up.
Yeah.
That's right. We did see, you know, participation is notoriously lower at the Commonwealth campuses, with one exception. I'd say Barron in Erie had very high participation involvement, as did University Park. So we're going to continue to study Commonwealth campuses, but in the context of this complicated daily diary design, so that we can map the local changes in policies and programs at the university, we decided we're going to keep it geographically limited.
Yeah.
Good question. We really struggled with that one.
A clarification question. Were the questions in wave 1 and wave 2 for the collections of data for the core study, for the subjects that were the same, were they identical?
Yes.
Yeah.
Everything we asked at the first wave, we used identical questions at the second wave. We added a lot at the second wave because of the pandemic. So it's impossible to have that pre-post, but things like anxiety, depression, food insecurity, substance use, feelings of belonging, discrimination, all of those questions were identically assessed pre-post. And that is the very next kind of report that we're anxious to do, is to dig into those data and see exactly what we observe among those 1,004 students, how they looked pre-post.
Great. Will these reports be available to the public?
That is also a great question. These are fantastic questions. I don't know the answer to that. We are actively producing reports for internal consumption because we feel that providing data-driven empirical evidence is always good. So we're going to continue to produce reports and share them internally. We need to get a firm answer on whether it's fine for us to share these reports out. I absolutely hope so. I would like to say absolutely, and in fact, I would like to even make them downloadable on our website. So we'll know soon, but I don't have that confirmation just yet.
Yeah, it's so early. Another follow-up question along those same lines: will you collect biomeasures as part of the COVID-19 and/or self-studies? And also, the opportunity to share this data with other researchers is very exciting. So how would you like or hope to see others engage in the analysis of these data to advance health and wellness outcomes?
Yeah, wow, 2 great questions. So the bioassay piece first. Yes, I would say yes and no. So Penn State Self was designed originally and proposed to study the biobehavioral underpinnings of substance use. And to do that really well, we need to, for students who agree to provide it, we need a cheek swab so that we can analyze their genetic information and link it to their behavioral data, again, with high security and anonymity. But so our original design was to look at genetic information, daily self-report information, and passively monitoring information like movement over GPS and phone usage and sleep and things. And so that was the original plan. We're still planning to do all of that. But I suspect what the audience is really getting at is, are we going to be monitoring their COVID? We thought long and hard about this. Was we were standing up this broader data for impact, data for action. It's action now. I think we switched in process, but this larger data for action umbrella at Penn State, we were really struggling with how these projects should all fit together. And we were very concerned that the intensity of assessment in Penn State Self would be a barrier to, if we also ask those same student participants to repeatedly come back into the lab and get the nasal swab for the COVID test, get a blood draw for the antibody test to see if they may have been exposed to COVID. So in the end, we decided we're going to stick with self-reported testing and test results for the students in our study, and we'll get the cheek swab for the DNA. It doesn't mean that we couldn't go back later. I could imagine us with an IRB modification, Courtney. I could imagine us going back and asking if we could get a blood draw at the end of the study to see if they've got antibodies that they show that they've been exposed. That could be really useful. But I say all of that, and we're going to be conducting, Penn State will be conducting an additional student study that will be surveying students 4 times a year and doing the COVID testing and blood draws at each time. So that study is happening. It's just, we decided to reduce participant burden. We will do 2 separate studies, our study and with the intensity of daily life and the expansion across all the days of the academic year. And then separately, 4 times per year, following a different, it could be overlapping, but a different sample of students, and tracking the virus, incidence of virus contraction, and that study will parallel a similar study of the community members in Center County, with 4 assessments per year for 2 years, with COVID testing 4 times per year for 2 years. And so the students and the community participants will have that kind of ongoing testing built in to their study. So trying to kind of do the best studies we can to provide complementary information.
Yeah, that's interesting. Thank you.
Yeah.
There was a question about, can you see how specific individuals change with the pandemic and not just the average?
Yes.
We
not
will.
Today.
Yeah, not today, not yet. That is the plan.
But you will.
Yes,
yes,
will.
Absolutely. Yes, my training is health and human development.
Yes.
I care about the individuals and the impact of these shocks to the system, in this case, the pandemic. And in the daily life survey, we'll be following the same individual across 21 days, each person, to again look at how things that happen in their lives are affecting them and how they're responding to it on that day or the next day. So absolutely. So for those 1,004 students, our next game plan is to link up their wave 1 and the pre and their post data and really study what we're seeing among those students that participated in both waves. And that's why we kept the measurement to be identical across the waves, because this has always been the plan. Really what this provides is what we refer to it as a natural experiment. We could never experiment with human lives by putting a virus on some and not another, or having a pandemic attack some communities and not others. But this happened, and we happened to have this like wonderful data set just before the pandemic hit. And so we call it a natural experiment. This thing happened. And so we as researchers felt deeply compelled to get right back in and get a second wave so that we could try our best to understand what the impact really has been on our college students.
And what's great is we have permission from those participants to link their data. So we have that all weaved into consent. So so we were set up to be able to link their data
to
together.
link the data, yeah.
Yeah, and you kind of had to. I don't, it's not like you had a choice.
Right.
We have a lot of parents on the program tonight, and I think there's some interest in how can parents best support their adult college students who really might not be talking about how this has affected them. Do you all have thoughts?
That's it. Yeah, I don't know. My kids are 11 and 13, so I don't have that experience of having a young adult college student yet. I will, and then she'll go to Penn State, I'm sure. But I think that what I believe is talking to your children about the actual, what's actually happening in the globe, around the globe, talking about the public health situation and not sugarcoating it, have them understand what's going on and understand what recommendations are and how, like, for me, it's so useful to understand how the disease can spread. And then they're going to be better equipped with that information about how to prevent it happening to them or their friends. I think also what my biggest concern for undergraduate students is the social distancing element. It's not natural for them. It goes counter to their tendencies and, you know, their college experience as they expected it to be, as they want it to be, and want to remember it as. And so I think that really helping them understand the simple preventive measures that we can take that are already, for a lot of us, starting to feel like second nature: the social distancing, the mask, and the hand washing, that if they understand that if they do those things, they can be social. And if they choose not to do those things, they're placing themselves and others at risk. So I guess I feel like there's a big education piece. And some students that might be experiencing more anxiety about this, it probably will really help them to talk about it, talk about what their fears are. Maybe they're afraid their parents are going to get the virus and they're older, you know, and they, you know, that's what's they're carrying with them. It's hard to say. Yeah. I think that you share the truth and share the public health recommendations and talk about it. It's absolutely most important. And I think that understanding that, and it's hard. I was an undergrad once too, like, but other people are very vulnerable, even if they're not. And so thinking of themselves as a vector, a person who could carry the infection and pass it on and never know it, that's a public health responsibility. I will say one other thing. I don't know how many happened to see President Obama's speech at the national high school graduation celebration that was televised, and his speech was designed for high school seniors, and it was a wonderful call to action for it was direct, and it was about everyone's responsibility going forward, and kind of this baton handing of you know, the next generation has to take this on because they're living it. And so I don't know, I would recommend that speech if people are open to that. And I think, you know, job security is going to be on students' minds, and I don't know, I don't have the answers for that, but the economic pieces of it, I think Penn State will surely be putting some programs together to help students as they navigate the job search, and that's going to be critical for our students.
And just to mention that, you know, Penn State does have resources in the arena of counseling to CAP. Parents could always, you know, suggest that to their students to take advantage of those services.
Absolutely. We have student counseling, and if social distancing is helpful or required, they're set up for telehealth, I'm sure. But absolutely, they should take full advantage of it.
Yeah. And Student Affairs also has their fund, the Student Affairs Fund as well.
That's a great point.
The Student Cares Fund as well, for those that need help financially as well too. And we actually had that as a part of our survey to see if the students were aware of that fund. And if they weren't, we actually had the link that they could, linked in our survey, that they could go to if they hadn't heard of it. So we were
That's
actually
perfect.
putting that out there for the students as
Yeah.
well. So if any parents need to look into that, they can search up student affairs at Penn State, and you can find the fund there.
The Student Emergency Fund.
The Student Emergency Fund, yeah.
Yeah.
Student Emergency Fund, that's right.
Yeah.
Yes. Yeah. Yeah,
Well,
a lot of students didn't even know. Yeah.
Yeah.
Right.
It's it's 9 o'clock. If you are all right, can we ask one more question?
Sure.
I just wanted, this is interesting, so I just thought it'd be great to hear. What results were most surprising to you both in the second round of this?
It's so fresh. I don't, I was like making the graphs right away.
Yeah.
That for me, I think that it was actually good to see that a lot of the students were practicing the social distancing and the mask wearing. And
Yeah.
I think the mask wearing, I think that, where there was a high, like 68% of the students were wearing masks, and always wearing masks. I think that was good to see that a lot of them, and washing their hands and everything. And they said always.
Yes. Yeah, I will say those results, that slide made me feel like we may be more successful at Penn State. If we're concerned about disease transmission, we may be much more successful having students maintain wearing masks than social distancing. I'm not saying we shouldn't ask them to social distance, but if they're not going to do that, they may be open to wearing masks. And so that's something to think about. The thing that surprised me, well, one thing that depressed me a little is 15% said that by May, they all had, 15% of this sample had returned to University Park campus, which not ideal. So probably to see friends or something. But the thing that surprised me the most, where is it? It was about students' perceptions of how severe or lenient the government regulations have been, and I can't seem to put my finger on that. But students, by and large, they do not feel that the policies and procedures that have been put on us by our state, like the stay-at-home orders, by our state, by Penn State, stay away from campus and don't come back after spring break. Very few of them thought that was too strict. In fact, many thought that the policies are too lenient.
Right here I have, it said only 15% said it was too strict.
Yes.
56% said about right. And 22% said too lenient.
Too lenient. More said that they're too lenient than that they're too strict. So it's a false assumption, I think, that our students don't want to do their part. I believe they really do. That was a great finding, I thought.
I want to see. I'm curious to see about the mental health. I want to see the depression and anxiety. We still
individual change.
Yeah, the individual change and everything. We have to do scales on those, so we don't have those results yet. We have to do some figuring on those first before we can see that and everything. But I'm curious to see how their mental health is doing. Really.
Yeah. And it would be even interesting well beyond the next few years.
Right. Absolutely.
Oh yes.
Yeah.
Yes. So these 1,004 students, you can be sure we will like to follow them over the course of their academic careers here.
Right.
Well, thank you both so much for spending time with us this evening to share your incredible findings. A lot of people wrote into the chat that they were grateful to hear what you had to say, that other parents were feeling anxious about their students, and just to know that there's good work going on around this. So thank you. And thank you to our alumni and friends for joining us this evening. We hope you will tune into our next HHG on Location Home Edition events. We'll be announcing our June lineup in the next couple of weeks, so be on the lookout for that. So thank you, everyone, and have a great night. Stay well, and we are.
Good night, everybody.
Good night, everyone.